Hello everyone, now let us discuss about 2023 E&M coding changes in the prolonged and standby services. Now coming to the changes that have occurred in 2023. The first change is prolonged service with direct patient contact, except office and other outpatient services. The CPTs 99354, 355, 99356 and 99357 have been deleted. These four CPTs have been deleted. The next change is for prolonged evaluation and management services on the date of an outpatient service or home or residence service or cognitive assessment and care plan. For the prolonged evaluation and management services on the date of a outpatient or home or residence service or cognitive assessment or care plan, you need to use 99415. So 99417 has been revised such that it can be used in conjunction with 99205, 99215, 99245, 99345, 99350 and 99483. Previously, it was used only in conjunction with new and established patients of office outpatient. 99215 established patient and 99205 is the new patient code for office outpatient. Now it has been revised. It has been used for home or residence service or cognitive assessment or care plan. For all the services, for prolonged evaluation management service on the date of any of the above mentioned service, you need to use 99417. And one new code has been added, that is 99418. This is a new add-on code for prolonged evaluation and management service on the date of an inpatient or observation or nursing facility service. For these, you need to use 99418 and this is a new addition. CPTs 99354, 355, 356 and 357 have been deleted and this CPT has been added. 99418 and 99417 has been revised. So these are the overall changes that have taken place. Now coming to prolonged service on date other than face-to-face E&M service without direct patient contact. Prolonged service on the date other than face-to-face E&M service. Here direct patient contact is not there. And the codes under this are 99358, 99359 are used when a prolonged service is provided on a date other than the date of a face-to-face evaluation management encounter with the patient and family or caregiver. The codes 99358 and 359 may be reported for prolonged services in relation to any E&M service on the day other than the face-to-face service, whether or not time was not used to select the level of the face-to-face service. Irrespective of the time, 99358 and 359 may be reported for prolonged services in relation. That means they must be related to an E&M service that was performed on some other day than the prolonged services. And this service is to be reported in relation to other physician or other qualified healthcare professional services, including the E&M services at any level on the day other than the face-to-face service to which they are related. They must be reported in relation to physician or other qualified healthcare professional services, including the E&M service at any level on the day other than the face-to-face service. That is, you can report prolonged service codes 99358 and 359 may be reported on some other day other than the E&M service. And this service must be related to the E&M service. Coming to prolonged service without direct patient contact may only be reported when it occurs on a day other than the date of the evaluation and management service. For example, extensive record review may relate to a previous E&M management service performed at an earlier date. This can be taken as an example for employing prolonged services. However, this medical record review must be related to the service or patient in which face-to-face patient care has occurred or will occur and relate to ongoing patient management. The codes 99358 and 359 are used to report the total duration of non-face-to-face time spent by the physician or other qualified healthcare professional on a given date, providing prolonged services even if the time spent by the physician or other qualified health professional on that date is not continuous. That time might not be continuous, but it must be reported on the day that is providing the prolonged service by physician or other qualified healthcare professional. So 99358 and 359, they are used to report the total duration of non-face-to-face time. And code 99358 is used to report the first 60 minutes of the prolonged services on a given date, regardless of the place of service. It should be used only once per day. 99358 must be used only once per day. And it is reported for the first hour of prolonged service on a given date, regardless of the place of service. And prolonged services of less than 30 minutes time duration on a given date are not coded separately. This is also important. If the prolonged service is less than 30 minutes, then it is not coded separately. And the code 99359 is used to report each additional 30 minutes beyond the first hour. It may also be used to report the final 15 to 30 minutes of prolonged service on a given date. And prolonged service of less than 15 minutes beyond the first hour or less than 15 minutes beyond the final 30 minutes is not reported separately. Prolonged services of less than 15 minutes beyond the first hour, that is 1 hour has 60 minutes. So a prolonged service less than 15 minutes, let us suppose 14 minutes, from 60 to 74 minutes, that is up to 74 minutes, you must report only 99358. So prolonged service of less than 15 minutes beyond the first hour or less than 15 minutes beyond the final 30 minutes. For every additional 30 minutes, you need to report 99359. So for example, let us consider 100 minutes. 100 minutes of prolonged care service has been done. In 100 minutes, for first hour, that is for 60 minutes, you will report 99358. And additionally, for the next 30 minutes, that is 60 plus 30 means 90. For 90, you will use 1 unit of 99359. And the remaining is 10 minutes. That is less than 15 minutes beyond the final 30 minutes. So for the 10 minutes, you will not report separately. For 100 minutes of time, you will report 1 unit of 99358 and 359. So prolonged services of less than 15 minutes beyond the first hour or less than 15 minutes beyond the final 30 minutes is not reported separately. Do not report 99358 and 359 for time without direct patient contact reported in other services such as care plan oversight services, which come under the series 99374 to 99380, chronic care management by a physician or other qualified healthcare professional, which come under 99437 to 99491, principal care management by physician or other qualified healthcare professional, which come under the series 99424, 99425, 426 and 427. In all these cases, you should not report 99358 and 359. Next, home and outpatient INR monitoring. 93792 and 93793, medical team conferences, interprofessional telephone, internet electronic health record consultations, or online digital evaluation and management services. In all these cases, the above mentioned and below mentioned also, you should not report 99358 and 359. Now coming to prolonged E&M services. The prolonged evaluation and management services that we have discussed earlier are 99358 and 99359 without face-to-face. without direct face-to-face contact. 99358 is reported for first hour and 99359 is reported for each additional 30 minutes. Coming to CPT descriptions, 99358 indicates prolonged evaluation and management service before and or after direct patient care, first hour. And 99359 is an add-on code. It must be given for each additional 30 minutes. Let us see an example. A 85-year-old new patient with multiple complicated medical problems has been moved to the area to live closer to her daughter. She is brought to the primary care office by her daughter and has been seen and examined by physician. The physician indicated that past medical records would be obtained from the patient's prior physicians, and that he will communicate further with the daughter upon review of them. So here she is a new patient, that is a E&M. So on one date, E&M service has been performed. And that day, the physician said that he will review the past medical records. So for extensive review, since she is 83 years old with multiple complicated medical problems, the next day, the physician reviewed the past medical records and spoke with the patient's prior physicians for up to 1.5 hours. So this is a prolonged E&M service after the direct patient care. Patient already has a face-to-face service with the physician. The next day, he started reviewing the old medical records and it took around 1.5 hours. So for first 1 hour, the CPT is 99358, and for the next additional 30 minutes, we are giving 99359. Here is the table indicating the total duration and number of units that must be reported. Total duration of prolonged service without direct face-to-face contact and the codes reported. For less than 30 minutes, you should not report separately. For 30 to 74 minutes, that is 1 hour, 30 minutes to 1 hour 14 minutes, you need to report 1 unit of 99358. And from 75 minutes to 104 minutes, that is 1 hour 15 minutes to 1 hour 44 minutes, you need to report 1 unit of 99358 and 1 unit of 99359. Next, from 105 minutes or more, that is 1 hour 45 minutes or more, you need to report 1 unit of 99358. 99358 can be billed only once per day. And additionally, for each additional 30 minutes, the respective units of 99359 can be coded. And more, 1 unit of this and 1 unit and more for each additional 30 minutes, depending upon the time. Now coming to next topic, prolonged clinical staff services with physician or other qualified healthcare professional supervision. The codes are 99415 and 99416. They are used when an evaluation and management service is provided in the office or outpatient setting that involves prolonged clinical staff face-to-face time with the patient and family or caregiver. The physician or other qualified healthcare professional is present to provide the direct supervision of the clinical staff. Here, patient will have a face-to-face prolonged clinical staff service. This service is reported in addition to designated E&M service and other services provided at the same session as E&M service. And codes 99415 and 416 are used to report total duration of face-to-face time with the patient or family or caregiver spent by clinical staff, not the physician, spent by clinical staff on a given date providing prolonged service in the office or other outpatient setting, even if the time spent by the clinical staff on that day is not continuous. Time spent performing separately reporting services other than the E&M service is not counted towards the prolonged service time. The time that is spent to perform other services Other reported services other than DNM service is not considered towards the prolonged service time. And code 99415 is used to report the first hour of the prolonged clinical staff service on a given date, and code 99415 should only be used once per day, similar to 99358, even if the time spent by clinical staff is not continuous on that day. Prolonged service of less than 30 minutes total duration on a given date is not coded separately. This is also same. Prolonged service of less than 30 minutes total duration is not coded separately. And when face-to-face time is not continuous, use only the face-to-face time provided to the patient and family or caregiver by the clinical staff. Next is 99416. This is an add-on code that is used to report each additional 30 minutes of prolonged clinical staff service beyond the first hour. And code 99418 may also be used to report the final 15 to 30 minutes of prolonged service on a given date. This is used for each additional 30 minutes of prolonged clinical staff service, or it is also used to report the final 15 to 30 minutes of prolonged service by clinical staff on a given date. Prolonged service of less than 15 minutes. This is also same. Prolonged service of less than 15 minutes beyond the first hour of, or less than 15 minutes beyond the final 30 minutes is not reported separately. And codes 99415 and 416 may be reported for no more than 2 simultaneous patients, and the time reported is the time devoted only to a single patient. They can be reported to no more than 2 simultaneous patients. That is, the clinical staff may attend 2 patients simultaneously. Codes 99415 and 416 may be reported for no more than 2 simultaneous patients, and the time reported is the time devoted to each single patient. And from prolonged services by the physician or other qualified healthcare professional on the date of an office visit or other outpatient service, you need to use 99417. And do not report 99415 and 416 in conjunction with 99417, because 99417 indicates prolonged services by physician or other qualified healthcare professional, whereas 99415 and 416 they indicate prolonged service by clinical staff. So you should not report 99415 and 416 in conjunction with 99417. Facilities may not report 99415 and 416. This is also important point. Now let us see the description of 99415. Prolonged clinical staff service, the service beyond the highest time in the range of the total time of the service. Prolonged clinical staff service during an E&M service in the office or outpatient setting, direct patient contact with the physician supervision. Prolonged clinical staff service, direct patient contact with the physician supervision, first hour. Let us see an example. A 52-year-old female presents with gastroenteritis and persistent vomiting. She is unable to tolerate food or liquid by mouth. She presents with signs and symptoms of clinical dehydration. Evaluation and management is performed by the physician, and the decision is made to begin IV hydration in the office. A hydration IV is initiated consisting of normal saline. Here you can see prolonged monitoring and observation for 1 hour ensures with intermittent evaluation of the patient by the physician. Here this prolonged monitoring and observation is done by clinical staff with the intermittent evaluation of the patient by physician under physician supervision. So 1 hour, that is, so for first hour you need to report 99415. Here the prolonged care service CPT is 99415. And additionally you need to report the E&M service also and other procedures or services that has been performed on the same day. Next is add-on code 99416 for each additional 30 minutes. Let us see the same example. 52-year-old female presents with gastroenteritis and persistent vomiting. She is unable to tolerate food or liquid by mouth. She presents with signs and symptoms of clinical dehydration. Here, prolonged monitoring and observation for 1.5 hours ensures with intermittent evaluation of patient by the physician. Here, the prolonged clinical staff service is 90 minutes. So, for first hour, we are reporting 99415, and for the next additional 30 minutes, we are reporting 99416. Here you can see the table for reporting prolonged clinical staff time. So in order to report 99202, typical clinical staff time is 29 minutes. And whenever the clinical staff time extends from 59 minutes to 103 minutes, you need to report 1 unit of 99415. Whenever it is greater than 104 minutes, you need to report additional unit of 99416 depending upon the time consumed. And for 99203, the typical clinical staff time is 34 minutes. If the clinical staff time exceeds from 64 minutes to 108 minutes, then you need to report 1 unit of 99415. And if it is greater than 109 minutes, additionally you need to report respective units of 99416. Similarly, for 99204, it is 41 minutes typical clinical staff time, and the time range for reporting 99415 is 71 minutes to 115 minutes, 115 minutes. And if it is greater than 116 minutes, you need to code respectively the number of units of 99416. And for 205, the typical time is 46, and the time range for reporting 99415 is 76 minutes to 120 minutes. And if it is above 121 minutes, you can use the add-on codes 99416 respectively. And for 99211, it is 16 minutes. And the time range for reporting 99415 is 46 to 90 minutes. If it is greater than 91 minutes, then you can use the additional units of 99416. So in simple words, 99415 and 99416 can also be reported for the additional 15 to 30 minutes range of typical E&M service. That point we have discussed earlier. So the time required for 99212 is 24 minutes, typical clinical staff time. And in order to report 99415, the time range must be 54 minutes to 98 minutes. And if it is greater than 99, you need to report the respective units of 99416. For 99213, the typical clinical staff time is 27 minutes. If it is ranging from 57 minutes to 101 minutes, you need to report 1 unit of 99415. And if it is greater than 102 minutes, you need to use respective units of 99416. Next, 99214. The typical clinical staff time is 40 minutes. And the time required for reporting 99415 is 70 to 114 minutes, 114 minutes. And if it is greater than 115 minutes, you can use the appropriate add-on code 99416 respectively. Next, finally, 99215. The typical clinical staff time is 45 minutes. And in order to report 99415, it needs 75 minutes to 119 minutes. And if it is greater than 120 minutes, you can use the add-on code 99416. This is the typical reporting prolonged clinical staff time table for new and established outpatient patients. Next, coming to prolonged service with or without direct patient contact on date of an evaluation and management service. So, with or without direct patient contact on the date of an E&M service. The code is 99417, is used to report prolonged total time. Prolonged total time, that is combined time with or without direct patient contact provided by physician or other qualified healthcare professional on the date of the E&M service or other outpatient services, office consultation or home or residence or care plan, etc. 99205, 215, 99245, 345, 350 and 483. And code 99418 is used to report prolonged total time, that is combined time with or without direct patient contact provided by physician or healthcare professional on the date of an inpatient E&M service. This is the new code. This is given 99417 is given for outpatient E&M service, whereas 99418 is given for inpatient E&M service. Next, prolonged total time is the time that is 15 minutes beyond the time required to report the highest level primary service. The prolonged total time is the time that is 15 minutes beyond the time required to report the highest level primary service. And the codes 99417 and 418 are only used when the primary service has been selected using time alone. 99417 and 418 are used only when primary service, the code for primary service has been selected using time alone as a basis and after the time required to report the highest level of service that has been exceeded by 15 minutes. And in order to report a unit of 99415 and 417 and 418, 15 minutes of time must be attained. Less than 15 minutes, do not report 99417 and 418 for any time increment of less than 15 minutes. This is also important. When reporting 99417 and 418, the initial time unit of 15 minutes should be added once the time of the primary E&M service has been surpassed by the 15 minutes. For example, to report the initial unit of 99417 for a new patient encounter, 99205, the minimum time required to report 99205 is 60 minutes. So, 15 minutes time increment after the minimum time required. That is, do not report 99417 until at least 15 minutes of time has been accumulated beyond 16 minutes. That is, in order to report 99417 along with 99205, the total time spent must be 75 minutes. That is 15 minutes greater than the time required to report the highest level service. And for established patient encounter 99215, the minimum time required is 40 minutes in order to report 99215. So 40 minutes must be exceeded by additional 15 minutes. That is, you can report 99417 along with 99215 when the minimum time is 55 minutes. For an established patient encounter, do not report 99417 until a last 15 minutes of time that has been accumulated beyond 40 minutes on the date of encounter. Time spent performing separately reported services other than the primary E&M service and prolonged E&M service is not counted towards the primary E&M or prolonged E&M service. And for prolonged services on a date other than the date of face-to-face E&M, you need to report 99358 and 359. For prolonged services on the date other than the date of face-to-face E&M. These services must be reported on the same date of face-to-face E&M, 99417 and 418. Whereas other date, you need to report 99358 and 359. And for E&M service that requires prolonged clinical staff time that may include face-to-face services by physician or healthcare professional, you can refer 99415 and 416 that we have discussed earlier. And do not report 99417, 418 in conjunction with 99358, 359, 415 and 416. This is important. Do not report 99417 and 418 in conjunction with 99358, 359, 415 and 416. Both 99415 and 418 are add-on codes only that must be coded along with the respective E&M service. 99417 is used for prolonged outpatient E&M service, whereas 99418 is used for prolonged inpatient or observation E&M service. And this is a new addition, new code. Coming to the description of 99417, prolonged outpatient E&M service time with or without direct patient contact beyond the required time of the primary service. When the primary service has been selected using total time, each 15 minutes of the total time. For each 15 minutes of the total time, you need to report 1 unit of 99417. Next, 99418, prolonged inpatient or observation E&M service time with or without direct patient contact beyond the required time of the primary service when the primary service has been selected using total time for each 15 minutes of the total time. For less than 15 minutes of increment, you should not report 99417 or 418. When coding based on time, we report 99205 for a new patient visit lasting from 60 to 74 minutes. And once the time reaches 75 minutes, because for less than 15 minutes you should not code 1 unit of 99417. So once the time reaches 75 minutes, you also may report add-on code 99417 because 75 minutes is 15 minutes beyond the minimum time required, that is 60 minutes. And similarly, when coding is based on time, you report 99215 for an established patient visit lasting 40 to 64 minutes. And once the time reaches 55 minutes, you also may report plus 99417 because 55 minutes is 15 minutes beyond the minimum time required for 40 minutes. Coming to next topic, that is standby service. Now there is only one code for standby services, that is 99360. It is used to report physician or other qualified healthcare professional standby services that are requested by another individual and that involve prolonged attendance without direct patient contact. Care or services may not be provided to other patients during this period, and this code is not used to report time spent proctoring another individual. It is also not used if the period of standby ends with the performance of a procedure, subject to the surgical package by individual who was on standby. This is also not used if the period of standby ends with the performance of a procedure. And code 99360 is used to report total duration of time spent on a given date by the standby. And the standby services of less than 30 minutes total duration on a given date are not reported separately. Second and subsequent periods of standby beyond the first 30 minutes may be reported only if a full 30 minutes of standby was provided for each unit of service reported. Second and subsequent periods of standby beyond the first 30 minutes may be reported only if the full 30 minutes of standby was provided for each unit of service reported. Now coming to the code description, 99360, standby service requiring prolonged attendance each 30 minutes. Example, operative standby, standby for frozen session, for C-section, high-risk delivery, for monitoring EEG, etc. Now let us see an example. A 24-year-old patient is admitted to OB unit attempting VBAC. Fetal monitoring shows increased fetal distress and patient's blood pressure is rising and labor progressing slowly. And a primary care physician is requested by the OB or GYN to stand by. So here he is providing, the primary care physician is providing the standby services to stand by in the unit for possible C-section and neonatal resuscitation. So here you can employ 99360. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.